Ever found yourself at 2 a.m. asking the internet questions like, why do I get hiccups? Or is cracking my knuckles actually bad for me?
Welcome to What Brings You In Today, a podcast by SGMC Health.
I'm Kara Hope Rockwell.
And I'm Erica Bennett. And today we're joined with Brandon Rockwell, MD, to answer some of the internet's most searched health questions. So, Dr. Rockwell, what brings you in today?
I'm here to answer some of the internet's most Googled internal medicine questions.
Awesome.
Not because your wife made you come on?
I was told I wasn't allowed to say that. Yeah.
Okay, so let's go ahead and address the elephant in the podcast room today. This is Mrs. Rockwell, so Kara Hope Rockwell and Brandon Rockwell.
Woo.
Love found at SGMC Health.
That's right.
All right. All right. Dr. Rockwell, go ahead and tell us a little bit about yourself and how you became an internal medicine physician.
I'm originally from Warner Robins, Georgia, and I've kind of lived in Georgia my entire life. I went to the University of Georgia for undergrad, and then I went to
Go Dogs.
The Medical College of Georgia in Augusta for med school, and then I came here for my residency, so I did an internal medicine residency here in Valdosta. I've kind of always had a passion for working with people, and I've always liked science, and medicine had the ability to kind of combine those two things together, where I could be really nerdy and passionate about something, but also kind of help people. So that's
Nice.
one of the things I like.
When did you know
medicine.
you wanted to be a doctor? Like, when did that click?
I think I was in college.
Okay.
I originally wanted to be like a marine biologist, but it's not really a real job. So.
Yeah, I mean, it's few and far between opportunities, I feel like.
Yeah.
You can go swim with the dolphins and
Yeah.
stuff. Very cool career, though, I feel like. Well, we're glad you're here.
Yes.
Me too.
Thank you. Internal medicine covers a lot of ground. What kind of patients and conditions do you typically see in your practice?
So internal medicine is a generalist for adults. So I see people over the age of 18 who are kind of all general conditions. So things like high blood pressure, arthritis, diabetes, high cholesterol, obesity, COPD, and it's kind of a general stomping ground for any general medical complaint you have.
For adults, right? So you also
For
treat
adults, yes.
only adults. Okay. All right, well, let's get to the fun stuff for now. So the internet's favorite medical question. First one up, and this has always been a big hot topic between Kara Hope and I.
Yeah.
How many hours of sleep should you get? Should adults get?
Yeah.
Or strive for?
So 7 to 9. And so the vast majority of the population needs 7 to 9 hours of sleep. So you'll hear about a few people who need like a lot less sleep. Like, if I think famously like Bill Clinton only needed like 4 or 5 hours of sleep, but that's representative of like less than 1% of the population.
Okay.
So 99.9% of people need somewhere between 7 and 9. And if you're getting less than that, you're probably not functioning at your best.
I need more than that, though. Just,
My watch did tell me this morning I got 10 hours last night, which
Oh.
I don't even think that, I do think that was a malfunction of my watch. I think it thought I went to sleep earlier.
My
But
sleep
10 would be
score
nice.
was 100 last night.
Okay, mine was 100 a day ago. It was only 85 last night.
That's one of our
We
favorite
digress.
topics to
Yes,
discuss.
because we do realize the value of sleep, right?
Yeah.
So, and you have to be intentional about it. I do think that's one of the good functions about a Apple Watch or one of those sleep monitoring devices.
Yeah.
You can kind of take that into your...
Yeah, those things are
Control.
kind of cool. You can kind of track, and it helps you keep track of a lot of different things.
exercise and stuff.
Yeah, exercise, sleep.
You can get competitive with that as well.
Yeah.
So, you're a big coffee drinker, so we have a coffee question.
Okay.
Does coffee dehydrate you?
So it depends what you're drinking. So it could. So it is kind of a weak diuretic, so it makes you pee a little bit. But your body it adapts very quickly, so you become used to it. So if you drink 2 cups of coffee every day, your body will adapt to that. And it's a weaker diuretic than it would if you said drink 4 cups of coffee. It's also, if you were to, it depends what you're drinking too. If you drank like espresso, there's very little liquid in that, so it probably is more of a diuretic. Probably is going to make you kind of dehydrated. But if you're drinking like lattes, which is mostly milk, probably not.
Okay. So you can get more milk in it and be a little better for
Or,
you.
yeah, just more fluid, yeah.
Fluid.
Yeah.
Okay. I had always heard that, like, when I was working out, back when I was actually working out, that if you drink a lot of coffee, you should drink like the same amount of water to just kind of like help.
That's probably true.
Yeah.
Yeah.
Help sustain you.
Yeah. Yeah.
And then this is a good question because I heard this today on the radio even. Is it normal to need caffeine just to function every day?
I say normal, no. But like I said, your body becomes really used to it. So if you drink coffee every day, your body's going to be missing that when you wake up in the morning and looking for it. And the way your brain kind of keeps yourself awake, it's adapted to get that caffeine. And when it doesn't have it, you're going to feel kind of lethargic and tired.
Yeah.
And you
So
might go
that's
through
how you
withdrawals.
kind of have like a caffeine addiction.
Yeah.
And then if you don't have it, you might have some
Yeah.
symptoms, like maybe have a headache or something like that.
Yeah.
Or be irritable.
Absolutely.
Some people say, don't talk to me until I've had my coffee. And I feel like caffeine consumption in general in our world is like a lot more than it used to be, especially with the rise of like energy drinks.
Absolutely.
And I feel like I can just walk down the hall of this place and see an energy drink in everyone's hand between Monsters and Olanis and Red Bulls and Celsius.
Absolutely.
Do you think there's going to be any subsequent
I mean, I don't
impact?
know. The FDA says you're supposed to drink less than 400 milligrams of caffeine a day, which if you drink one of those, if you drink 2 energy drinks, you're probably going to push that limit.
Okay.
There's a lot of caffeine in some of those.
Yeah.
Like 100, 150, or 200.
There's like 200 in the Alanis and the Celsius.
Yeah, and they taste good. Mm-hmm. So, I think if you're drinking more than 400 a day, you probably will eventually notice the consequences.
Yeah, I've heard that we've actually had like people present to the ER sometimes too, because they
Heart
have like
Well,
a
what Panera had like a lemonade that had like 200 milligrams of caffeine in like a regular cup, but they didn't advertise that.
Right.
And somebody drank like a whole gallon of it and died.
That is interesting
crazy.
that you said that because they really don't advertise it much even on the energy drinks. Like you have to really dig on the nutritional label to figure out where it is. It's not on the like nutritional facts. It's always in some fine print elsewhere. Because for a while I thought Celsius was just like a vitamin drink. I did not realize the way they marketed it. I didn't realize it had.
Yeah, I think those Alanis.
I mean, I was drinking them at night.
Alanis did the same thing.
Yeah.
They taste good.
They do taste
I wish they
really
just sold them without the caffeine.
Yeah, and at least you could trick your brain a little bit.
Yeah.
It'll feel like you're getting that coffee.
A decaf energy drink.
Yes. All right.
People love to debate this one, and I am very, very guilty of it. Is cracking your knuckles, neck, or back actually bad for you?
No, it's not bad for you, but it is kind of gross.
He always tells me that it's gross when I pop my back.
The joint space is, you got this tissue called synovium, and it has some fluid in it. And what can happen is little gas bubbles can kind of precipitate out in that fluid. And when you pop, you're kind of bending your ligaments and your tendons, and you can push on that gas bubble and pop it. So that's what that noise is. But no, it's not bad for you.
So I've always heard that you're going to get like big knuckles if you pop your knuckles like that. I think my mom maybe just told me that to scare me and make me stop doing that as a child. One of those like myths. Yeah. And then also I'm just deathly afraid of popping your back. I feel like you're going to do something you're going to tweak something and be injured.
I don't like it.
Not a fan of the back.
Bad.
I cannot sleep at night unless I pop my back before I lay down. I am a freak though. So.
All right, well, speaking of sleeping, so this is funny that this is a popular question. What causes that sudden falling sensation or body jerk as you're drifting off to sleep?
Yeah, so those are called hypnic jerks, if you want a $10 word for it. Okay. But basically what happens is when your body starts to fall asleep, parts of your brain kind of fall asleep at different paces. And so you can lose a lot of muscle tone very quickly. And then your brain kind of misinterprets that signal as, hey, you're falling, because you've suddenly lost muscle tone, and it sort of jerks back. So that's what that is. So those are very common. very common. Most people have hypnic jerks, and it's normal.
It's not necessarily you're dreaming like you're falling off a cliff.
It's your body being confused.
Yeah.
You're tricking your brain.
Most people aren't aware that they're jerking in their sleep.
Yeah.
Okay.
Interesting. What is more important for weight loss, diet or exercise?
That's a little bit of a loaded question. But I would say in terms of purely weight loss, that diet would be more important. So your weight is calories in and calories out. So
that hasn't changed over the years.
No, it really hasn't. Some people do metabolize different kind of macronutrients a little differently, but it still has held up that it's calories in and calories out. So if you can calculate your basic metabolic rate, which is the rate if you just sat still all day, how many calories that you would burn. And it kind of depends on your age and your weight and how tall you are and your gender, whether you're a man or a woman. And for most people, it comes out to be about 2,000. So, if you're eating less than that, so if you eat 500 calories less than that, like 1,500, you're going to lose weight in a week. You're going to lose about a pound a week. Now, exercise is very important for your overall health, and the benefits of exercise to your cardiovascular health are, there's no pill that you could ever give that would have the same benefits as in exercise. So you got to exercise. So cardiovascular exercise every day for at least 30 minutes, and then strength training at least a couple times a week.
How do you convince or motivate your patients to take that step to do exercise for their health?
Yeah. So it's a little easier if somebody has a complaint or like a medical issue, and I can say, hey, if you do this, if you just exercise, you'll probably feel better, or you might help prevent the next heart attack or the next stroke, or maybe you won't have as much pain when you walk anymore. So those kind of things do motivate people.
But they had to have had like a bad, a major event to kind of help.
No, you used to meet people where they're at,
Yeah.
But if you're looking to prevent medical problems in the future, there's nothing that's more beneficial than exercising every day.
I know.
It's like we know that, but it's still hard to like make yourself.
To
make yourself actually do it.
But you feel better when you do it.
You just gotta take that first step and then build on the momentum.
And you have to find
good.
something that you enjoy doing. If you don't love going to the gym, maybe you like going for a walk around the block or something. But there's many opportunities. You just have to find something.
Things, or cycling, or running, or team sports, or anything.
Pickleball.
Pickleball. Yeah, a little less aerobic, but yeah.
Brandon's a big pickleball fan.
Yeah, I am.
Are you good at it?
I played tennis.
Okay, that's good.
Tennis growing up, so
I
kind of have an edge in ping pong.
He does.
Okay, speaking of exercising, why do I feel more sore 2 days after exercising versus the first day after exercising?
Yeah.
Is it DOMS?
DOMS?
Am I right? DOMS?
Yeah.
That's the only answer.
Delayed onset muscle soreness. So when you're exercising, especially if you're doing like strength training or like heavy endurance exercise, like you're running half marathon or something like that, you're creating small tears in your muscle fiber and your soft tissue, and those things have to heal. And when as part of the healing process, you get some inflammation. And so whenever that inflammation peaks is when you feel the most pain. So
when you feel that soreness when you're trying to walk down the stairs 2 days after you did some squats or trying to use the restroom.
Squat for the first time in a year, you're gonna struggle to walk in a couple days.
What is one thing people spend money on for their health that isn't really necessary?
It's kind of a hard question, but I think probably supplements. If as long as most people don't need supplements, unless directed by your healthcare provider. The vast majority of people don't need a multivitamin. They don't need to take additional supplements over them. They just need to eat a well-rounded diet.
But I guess like mentally it just feels like you're getting the edge up if you can take these.
Yeah.
But I mean, that's what the industry is capitalizing on people's thoughts like that.
Yeah.
Like all the protein, and it's expensive to
It is.
to purchase all these things.
Some of those things are very expensive. And they kind of, they're good marketers. They people care about their health, and that's what they market towards.
Glutathione, liposomal glutathione. Do you know what that is? That has been in my feed, and I ordered it and took it for a month. I don't think it did absolutely anything. It tasted pretty good, though.
That's supposed to help with, like, arthritis, right?
I don't know. It's supposed to make you younger. It's supposed to, like, help you younger. So I think it was supposed to, from what I gathered from the marketing thing, was that it helped you detox, like, toxins in there. You know, I think I got fed.
Yeah, that sounds fake.
Yeah.
But how many people are doing that? That's, anyways.
Probably a lot.
Sad. I'm not ordering it again.
The issue with a lot of things like that, or, like, more common ones are like St. John's wort or Prevagen,
the brain health.
They advertise that all the time, is that they're just not rigorously studied. So there is no evidence to suggest either way. In some of those, there's not even really any theoretical plausibility as to why they would be beneficial.
Yeah.
And some of them, I mean, it might actually harm you to take it. Like, you don't know what...
You just don't know. You can't really give advice either direction.
Yeah, and I've seen, like, even there's sites you can go on where they try to test if the different supplements are valid. You know, like, they're testing the supplements to see which
stuff
ones
like that
are...
on Instagram.
Anyways, okay, so just stay away from that unless advised.
Yeah.
You can save somebody.
The supplements in general... The FDA doesn't regulate those.
Right.
So in order to brand it as containing, glutathione...
I don't know.
It could have a whole lot of glutathione or it could have very little glutathione. And so the dose isn't regulated. And dosing is very important with any medication. So
Okay,
This is something else I see on Instagram a lot. Why do random aches seem to appear after age 30? It's like our bodies are falling apart when
it's punishment for your past sins.
It's trying to convince you that you are indeed aging and you are not 18 anymore.
Yeah. Your body breaks down a little bit as you age, and some of the soft tissue kind of breaks down, and your body doesn't heal with the same capacity that it had before.
I don't like that.
Yeah.
Getting older.
Why do our brains, this is not on the question, and you probably don't have the answer to this, but there probably is a disorder with this where you don't feel like you're getting older. Like, why do our brains not, like, recognize age?
Yeah. I think that's an interesting question. I don't feel like I'm a whole lot older than when I was 20. I just feel maybe a little wiser, a little bit.
Yeah. And then you're like, holy cow, I'm a lot older than I thought I was.
Yeah.
And it, like, happens very fast.
Yeah, I don't know.
But I've heard that from a lot of people, so I'm not the only one.
I definitely feel that way, too.
It's like our brain's not registered for years.
Yeah.
I don't know, maybe it just goes by so
Time
fast.
is a construct.
Yes, yes, and that's what's weird. Okay, so how often should you get a checkup if you feel healthy?
I would say that for most people, every year.
Yeah.
So kind of a general...
And so you can remind yourself that you're a year older. This could be your...
I mean, I don't know about that, but...
It might help with that brain construct, though,
Yeah.
of time. And is that, like, just a good basis so you can see if anything's changed in, like, your numbers and all that? I mean...
Yeah, absolutely. So it depends a little bit about what kind of... if you're a younger person under the age of 30, it depends a little bit on your kind of risk factors, is like your family history of how much risk you have for cardiovascular disease and other diseases in the future. But starting at the age of 30 to 35, we have good evidence to suggest that people should start undergoing yearly screening for high cholesterol, for diabetes, and it's a good chance to kind of check in with your health in general.
I finally convinced my husband to go to primary care doctor. He had not been since he was pediatric.
Yeah.
So like 18.
Yeah.
And so that just goes to show how too you can work in healthcare and like know that again you're not doing it. I was so proud of him. I taught him how to use the My Chart and get your results and all that stuff. So we were like learning this together. But he had a little bit of high cholesterol, and you would have never thought it because he's overall very healthy. He's not overweight by any means. He's very active and stuff. So just kind of that hidden.
Yeah, it's just kind of some preventative maintenance, and it makes you think about it a little bit.
Yeah.
And I feel like it's a little bit different for men than women because as women, we're going to our OBGYN every year and getting, that yearly checkup, but men don't do that.
Yeah, you're sort of obligated to go. And men are nice and stubborn, too.
Yeah.
We know.
And I think I've been
It's
trying to get
easy,
him to go for like 100 years.
Yeah.
And he finally went. I was so proud of him.
What would
Very
you
good.
say
Felt
to the
serious.
men to convince them that they need to go to the doctor?
Well, it's the right thing to do.
Yeah. Listen to your spouse.
Yeah, listen to your wife.
It'll make her happy
answer.
because she wants to know that.
Yeah.
I'm guilty of this one. Why do some people have naturally cold hands and feet, even when everyone else is comfortable?
Because they keep ice in their pockets. And
What about on their toes?
Yeah.
Some people have cold toes.
Yeah.
I have very cold hands and feet.
Yeah. When your body temperature drops a little bit, blood kind of moves to the middle of the body to kind of help warm it up. And that's why the blood vessels can constrict a little bit. So if you're a little thinner and you have a little less insulation, you can be more prone to having cold extremities.
But the tip to do that is just put your cold feet on your husband.
No, see, that's what my husband does to me. And I'm like, your toes are like ice. I actually made him put on socks the other day. I was like, if you want to rub your feet on me, put on some socks. Because they're cold.
There you go.
But so is it because, like, especially at nighttime, like when you're going to sleep, would it tend to be more cold at that time?
Yeah.
Because of that?
Yeah.
Okay. So there is
Cool down
now I
a
can
little
answer that question about the cold toes. All right. Stress. Okay, stress. Everybody's probably got some level of stress in their lives. And it can cause physical symptoms like stomach problems, headaches, hair loss. Or can it cause, that's what it says, can stress really cause physical symptoms like stomach problems, headaches, hair loss, even chest pain?
Absolutely. So, your nervous system has the ability to go into like a rest and digest or kind of a fight or flight mode. And so if you're chronically stressed, your body is chronically in that fight or flight mode, where you think you're like running from a bear, but actually, you're just going to go on an interview or
You're just going to call somebody.
call somebody. Oh, I got to call the maintenance guy. And so having that kind of chronic stress and your cortisol becomes elevated and your adrenaline becomes elevated, that will put kind of sheer stress on all of your organs in general. In fact, I had read a study somewhere that being chronically stressed is the same as smoking 5 cigarettes a day.
Dang.
Wow.
So it's good to be relaxed.
And cortisol, like, I feel like I hear that word more and more and more, your cortisol levels. And is there a way that you can even check to see what your cortisol levels are? I mean, you hear about them being high or low. Or
Yeah. So I would say that, yes, it's a test that can be checked, but it should only be checked in certain scenarios, uncommon scenarios. So if you're kind of generally feeling stressed, it doesn't do any good to check it. Because your body is very good at regulating itself.
Is it, though?
It is.
Is my body good at
It's good at regulating itself.
So if you exercise, that can help lower your cortisol levels,
So,
right?
Exercising, sleeping right, eating right, making sure you're social, drinking less, not smoking, all those things.
You just stole my next question. What simple lifestyle changes can improve mental health?
Yeah. Exercise
Lowering
is
your
incredibly
cortisol.
important.
Yeah.
Making sure that you get, your 7 to 9 hours of sleep every night, going to sleep at the same time every night, waking up at the same time every day, eating a well-rounded diet with fruits and vegetables, less Krispy Kreme.
Man. How about
good.
Chick-fil-A?
Oh, that's good.
It's the Lord's chicken. So it makes you happier.
Yeah.
So morning people, are you born a morning person? And there's night owls too. So can you train a night owl to become an early riser?
Yeah, so some people are born more of, their circadian rhythm is sort of set a little differently. So they're going to go to bed a little earlier and wake up a little later. And some people are going to go to bed late and wake up later.
Can you train yourself to change that?
I think it's hard to divert from what your body wants to do naturally. But I'd say yes, you can. Yeah. I'm probably more of a night owl by nature, but as just life and having a job kind of forces you to be a little bit more of a morning person.
Yep.
But if you are more of a night person, maybe you need to be a little bit more diligent about your sleep schedule. Yeah. Don't change it on the weekend,
Yeah. And don't scroll in the bed.
Yeah, don't scroll in the bed. And don't watch TV.
Doom scroll.
It's so easy.
The doom scroll.
Yeah.
How much water do we really need each day? Is 8 glasses really the magic number, or is that a myth?
So for general maintenance, a good rule of thumb is take half of your body weight in pounds, and that is ounces. So if you weigh 150 pounds, that's 75 ounces, which is close to eight glasses of water. The fluid status, that kind of assumes that you have healthy functioning kidneys and heart and liver. And so it's something that if those things are you have issues with those, you might be told to do things differently.
Yeah.
Yeah.
Like if you're retaining water.
You might be told to drink differently.
Okay.
Interesting.
What's one myth that you hear all the time that simply isn't true?
Oh man, I also feel like this is a loaded question, but I think that after COVID, there are a lot of people who are very resistant to vaccination in general. In terms of a medical intervention, the risk of giving a vaccination is very low. The rate of serious adverse events is close to 1 in a million. So the benefit of that is pretty substantial.
Yeah. It was just so heightened, the whole situation.
Yeah, there was lots of misinformation
Yeah.
surrounding vaccination, and now it's something that people are kind of hesitant about. I see adults, so I'm thinking about adult vaccinations, and I think that
What
people,
are common adult vaccinations?
Yeah, so it doesn't. The flu. When as you age a little bit, there's some kind of more vaccination. So if you're over the age of 50, thinking about the shingles vaccine, thinking about being vaccinated for pneumococcus, and now the RSV vaccine as well, which they do help prevent hospitalizations and serious illness and sometimes mortality.
Well, I've met a few people that have had shingles, and they are very adamant that you should get the vaccine.
Yeah. Anybody who has it will tell you they wish
painful.
they didn't.
Yeah.
And sometimes those effects don't go away.
Yeah.
Yeah.
And then speaking of the flu, just because flu is coming, so and interesting enough with the COVID pandemic, that first year, or I can't remember, I think it was the first year that we had our flu season during COVID, we were very worried that we were now going to get another, inundated with flu patients when we were already overwhelmed with COVID.
Yeah.
And we saw almost no flu cases,
Yeah.
which obviously everybody was wearing the mask and distancing and hand washing, doing, and not to say that you have to wear a mask all the time with the flu, but even just that hand hygiene tend to knock that out for that season.
Yeah.
That was just kind of a bizarre thing though.
Yeah, it kind of was.
We saw that
social
year.
isolation really helped. It's
but the flu vaccine is proven pretty. I mean, it's
yes, the flu vaccine is
helpful.
effective in preventing. It's not 100%. But even if you were to get the flu vaccine and then you were to get the flu is less likely to be detrimental. So the burden of kind of how sick you are, it's going to be less.
That's one we deal with a little bit more in healthcare because we are required to have a flu vaccine if you work in a healthcare setting.
Yeah.
All right, to wrap everything up, when should someone stop Googling their symptoms and go to the doctor?
If you're having, issues, it's always good to stay informed and invested in your own health. But if you're having problems, your health is a serious thing. You should go talk to somebody.
Yeah. Where can somebody find you as their doctor?
I'll be at Valdosta Medical Clinic.
All right.
Very good. Well, we will certainly add the information below for Dr. Rockwell's clinic. So if you're interested in becoming a patient, you can fill out an application and you can become his patient. So thank you, Dr. Rockwell, for coming and sitting down with us and answering the most Googled questions, what the people want to know.
This was fun.
Thanks for tuning in, and we'll see you next time.